Sebaceous cysts. Pathology. Sebaceous glands are one of the normal skin components. Obstruction of a sebaceous gland duct leads to accumulation of the gland secretion with gland enlargement. Causes. Damage or blockage of a sebaceous gland or its duct by previous local trauma months or weeks before detection of the cyst, which grows slowly. Other causes: congenitally deformed duct, post-surgery damage, genetic in patients with Gardner syndrome or basal cell nevi syndrome. Other possible causes: acne, also called pimples or cysts, duct blocking by dirt, bacteria, oil, or keratin. Basal cell nevi syndrome is a group of defects caused by a rare genetic condition that can cause tumors in the jaw. Skin trauma, uh, such as scratch, can cause cyst or develop over time. Surgical procedures, post-surgical fibrosis leads to distortion and obstruction of the sebaceous glands or their ducts. Gardner syndrome, although rare, sebaceous cysts could be caused by this uh, inherited disease marked by non-cancerous growths throughout the body. Sites. It affects mainly the face, the neck, trunk, scalp, or scrotum. Symptoms: psychic problems due to the visible lesion in the face, neck, and trunk. Cosmetic skin makeup problems. Small cysts are typically painless. Large cysts can range from uncomfortable to considerably painful ones. Large cysts on the face and neck may cause pressure and pain. Signs: a visible small lesion in the face, neck, trunk, and skull. Filled cysts with white toothpaste-like foul-smelling discharge. Most of them are soft on palpation. Some cysts might show signs of local inflammation. The punctum is the external end of the obstructed duct. Clinical cases: signs of malignant transformation. It is considered unusual and possibly cancerous if it has a diameter of more than 5 centimeters, a fast rate of recurrence. Its malignancy is sebaceous carcinoma. Sebaceous carcinoma. Many tumors may show sebaceous differentiation, approximately 75% occurring in the periocular region. It is the fourth most common eyelid tumor after basal cell carcinoma, squamous cell carcinoma, and melanoma in the United States. It presents 1 to 5% of eyelid malignancies. It is more common in Asian countries, 30%, 33% of eyelid tumors, and the second after basal cell carcinoma. The upper eyelid is involved 2 to 3 times more commonly than the lower eyelid. It occurs in the sixth or seventh decade of life, with a wide range from early childhood through the 90s. Women are affected more than men, 55% of women to 77% of cases. Sebaceous carcinoma, periocular lesions. Sebaceous carcinoma, extraocular lesions. Differentiation from dermoid cyst. Sebaceous cysts occur on occlusion of the ducts of the sebaceous glands, but dermoid cysts occur either on congenital sequestration of multipotential cells or on implantation of skin elements deep to the skin surface. Sebaceous cysts occur on hair-bearing body areas, back, face, neck, scalp, or scrotum, but dermoid cysts occur along the lines of embryological fusion. The overlying skin is attached to the sebaceous cyst by the occluded uh, duct, the punctum, but it is not attached by any means to the dermoid cyst. A punctum is always present in sebaceous cysts, but it is always absent in dermoid cysts. Sebaceous cysts contain toothpaste-like whitish foul-smelling material, but dermoid cysts contain ectodermal, mesodermal, and endodermal tissues or organ parts. Sebaceous cysts never show intracranial communication, but dermoid cysts may show intracranial communication. The palms and soles, the hairless areas, are not affected by sebaceous cysts, but might be affected by implantation dermoid cysts. Treatment. Excision of the cyst and its duct with an ellipse of the overlying skin having the punctum at its center. The log diagrammatic representation of the excision of the sebaceous cyst with its duct and punctum. A video showing surgical excision of a sebaceous cyst. An elliptical skin incision is planned to do, and cutting the skin. The end of the ellipse from one side, undermining the skin around, undermining the skin around the cyst with the ellipse of the skin attached to it, containing the punctum, and the section deep to the cyst to separate it from the depth. Sharp dissection. The cyst with its punctum has been excised. Now, closure of the skin, subcutaneous tissue, and the skin by interrupted suture. Good luck and best wishes.